Gastroesophageal reflux disease, or GERD, is one of the most common GI problems that we have in the Western culture, and it affects about 20 to 25% of the population. It may even be higher than that. GERD is a function of a number of things. It relates to a weak lower esophageal sphincter. The muscle at the base of the esophagus as it enters the stomach is weak. It can also be associated with a hiatal hernia, which means the hole in the diaphragm that the esophagus travels through enlarges, and then the top part of the stomach can go up into the chest. The minimally invasive surgical approach to reflux involves laparoscopic surgical techniques and several small instruments about the size of your ballpoint pen to accomplish the operation. There are several things we need to accomplish with a successful surgical intervention for reflux. One of those is to repair the hiatal hernia. In addition to that, we can perform a fundoplication, which involves taking the stomach and wrapping it around the esophagus. That's called a Nissen. And we have a new device now called a Lynx, which is a magnetic sphincter augmentation device. And basically we place that around the esophagus, and that replicates the valve function of the lower esophageal sphincter that is no longer functioning appropriately. The third option for patients who have reflux is reserved for patients who have a body mass index over 35, and those patients would be eligible to have a hiatal hernia repair and a gastric bypass, which would not only improve their reflux, but it could improve a number of other health issues. And laparoscopic and robotic surgical procedures with their smaller incisions involve less postoperative pain, quicker recovery, less risk of infection, less risk of postoperative hernias, and a quicker return to normal activities. There's really no reason to suffer. We'd be happy to sit down with you and come up with some treatment options just to help you feel better. It'll improve your quality of life, it improves your sleep, it improves how you can eat, and just makes you feel better in general.